So, my fellow cripples, I'm going to talk about the prevalence of chronic low back pain. This is a systematic review. So it'll be interesting to see how many people have like degenerative disc disease. But this is just prevalence of low back pain. I mean, if you have low back pain, I feel like there's a chance you're going to have degenerative disc disease. Um, so the results, they took 28 studies. I think just some didn't have like a lot of responses, but I'm going to be focusing on figure two from this meta-analysis. They took 6 studies. I can only assume these are the best or most reliable, and you should be able to see the visual now. And I'm gonna kind of base this video and my comments of this because I'm a very visual person. I think this works really well. Now, if you look at, for example, the Silver or Freiberger study, when people were 18, you got like 1, maybe 2% of the population suffering from chronic low back pain. But if you look at Almeida, 2008, it's like 12% of the population. But there's definitely a general upward trend for all the studies. So it increases as, we get older, and we know that degenerative disc disease, low back pain increases as we get older. Like, that's just a natural thing. Seems to like stop increasing for the graphs at around 55 and then plateaus, but it really varies based on the different study. So the lowest rates are in the Freiberger and then also the Silver study, I believe. Now, that kind of peaks out around 6% of the population have chronic low back pain. The highest one is Almeida, which is like 18% of the population have chronic low back pain. And this is at the age of like 55 to 62. Now, I wouldn't be surprised if like 18% do have chronic low back pain, but it's going to be hard to get like that true figure because we're not going to interview everyone. But it's safe to say it's probably around that 5 to 18% mark of people that suffer from chronic low back pain. Now, I want to do some more research into this. I want to look more, but I will reference the, I guess, systematic review, meta-analysis, whatever you want to call it. I'll link that down below, and I'll link this figure as well. And if you want to go check out these individual studies, like you can see their name, feel free to go check them out. I haven't looked at them, but yeah, maybe it could give you some good insight. And thanks for watching.